much. Thank you, everyone. I hope that everybody online has joined us as well. Today we're going to be talking about the Medicare Guide program. It's a brand new program that was released by Medicare. It is an 8-year program. They had 1 year of pilot, and so now we're starting kind of this next phase. I'm Marianne with Visiting Angels. I do community engagement. Myself and Rebecca from our office, we're often in the communities doing educational series and answering questions, talking about home care and other programs that affect seniors in our community. So what does GUIDE stand for? GUIDE stands for Guiding an Improved Dementia Experience. A couple of things that we'll cover. I already introduced myself. We'll be talking about dementia and caregiver facts. Why is it needed? What is the GUIDE program? Who qualifies? What is the process? Some resources, maybe some questions at the end as well. So I think many of you are already familiar with dementia and Alzheimer's and different facts that are in our community. Most importantly, you might have a loved one that it's really affecting your own life. You might be a caregiver, you might have a family member where this might run in your family, and you might want to start getting information. In America, nearly 7 million Americans are living with a dementia and Alzheimer's. An estimated 1 in 9 people aged 65 and older, 6.9 million Americans, has Alzheimer's. Almost 2/3 of Americans with Alzheimer's are women. It's the 5th leading cause of death among people aged 65 and older, and that's in 2024. And those numbers seem to be going up. We have a large aging population in America, so we just have more seniors in our community. What are the trends? As the US population ages 65 and older continues to grow, so will the number of Americans affected by dementia and Alzheimer's. People with dementia often lead to higher rates of hospitalization and ER visits. Sometimes it might just be, a fall. It might be, not being able to communicate, illness or injury. There's a whole host of reasons why patients and family members might be bringing their loved one to the hospital or for an ER visit. People with dementia may also have behavioral health symptoms and often need 24/7 care. What we see in home care is often families are navigating their loved one's care by themselves for some period of time. Because mom is just being a little forgetful, or maybe dad has he's not as steady on his feet. He gets a little confused. And then as the disease progresses, sometimes it is beyond the ability of a family to really care at home, because it's just people need to work. Often we call it the sandwich generation, where you have maybe mom and dad at home, and then you have young children at home as well. And so you're in the middle where you're trying to care for young ones, and then you're also caring for your aging parent. And so it just creates more strain. And again, we have limited time. And so we have to work. And so what we find is that at some point, the disease might progress where care is needed. So here's some caregiver facts. Many folks that are navigating dementia and Alzheimer's at home with their loved one, they become a caregiver. Because, again, it might start really small. Mom is being a little forgetful, dad is getting confused, and you're just managing that at home. And then the disease starts to progress, and all of a sudden, all of that support that mom might need, you're just taking it on, and it becomes like a gradual progress. And then it starts to, even not directly, or maybe not, very subtly, it starts to take your time, take your energy, start adding to your stress. What we're seeing is that 74% of caregivers are concerned about maintaining their own health since becoming a caregiver. They're feeling it, whether it's time, whether it's stress, whether it's their own health. They might see that being expressed for themselves. 70% of those supporting persons with dementia also say that coordinating care is very stressful. Not many people have dementia experience. right? So this might be new to you. And all of a sudden, mom, who has always been lively and bubbly, and she's been the person that's always navigated like family events, all of a sudden she's starting to become forgetful, and she's becoming frustrated, and she's not able to do what she wants to do. And you're seeing all of these different things, and what you're seeing is you're trying to really care for mom in a way that is supportive, that is loving and careful, but also the disease is progressing. And it stresses the caregiver out. We don't always have time to do all of this research. We don't have time to take care of our children and then take care of mom, and then also be up on the latest and greatest in terms of the disease and how it's progressing and what you can do. So there's a lot of stress that happens with the caregiver and within families. 2/3 of our caregivers are also having difficulty finding resources and resources that support their needs. And so not just the needs of the loved one who might be experiencing memory loss, but their own needs. I will say that we are very fortunate here in Charlottesville. We have a community that is really supportive of our aging population here. We have many supportive caregiver groups like this one. We have ones that are connected to the hospital. We have ones that are connected to the center. And that's really a rich community that cares about caregivers and our aging population. A lot of communities, I mean, we work in some of the rural parts of Virginia and central Virginia, and truly, there's some areas in our state that don't have those resources. And you could really see the effect, because the caregiver that calls us is often stressed. There's some kind of, something that has initiated their call. Mom has fallen, they need care. And in their own area, sometimes they don't have many choices. We have some folks that are calling us from 30 and 40 miles away because they don't have as many options as we have here in Charlottesville. The challenges of providing constant support and dealing with the behavioral and psychological symptoms of dementia can present a significant mental, physical, emotional, and financial burden for caregivers. And I think that is really very, it seems obvious, but I think the way that we experience that changes depending on the individual and our own resources. So the mental and physical, emotional, and the financial burden. Like, in order to go to work and make sure that mom is safe, it might mean calling visiting angels, and that's home care. And there is an expense there, right? It might mean that you're trying to get some tests and some support from doctors and healthcare providers. Well, that's your time and your energy, right? Maybe you have to take time off of work. All of those things that you're trying to navigate because you love your loved one, of course. It also means you trying to navigate all of those things. And it's really showing in how our caregivers are taking care of themselves, and also the stress that they are experiencing. So why is the GUIDE program needed? So what we're seeing, what Medicare is seeing, is that over 7 million Americans are living with dementia. And again, we have an aging population, so we know that number will go up in the next few years, right? There's a fragmented care system that leads to poor outcomes. So what that means is, you can get help. But you can get help at the hospital, and you can get help at from your PCP, and you can call for home care, you can call for home health, but you are navigating all of those things while you're also trying to navigate your own home and your children and your job. And so it's just a lot. And so we know we have a fragmented care system. Again, I will compliment that, in Charlottesville we have resources. We have JABA. If you don't know where to go, who to call, you can call JABA, and they will help you find and identify resources. You can go to the center, and you can find and there's presentations, so you can get information. But it's still you going out and getting these things, so it feels very fragmented. Also based on your time, your own energy, and your ability to access these different information sources. There is a high rate of ER visits and hospital stays. Again, the caregiver is often not an expert in dementia and Alzheimer's, and so you're just trying to navigate as best as you can. In addition, the loved one is maybe not able to fully communicate what they're going through. And so you're doing the best you can in responding to physical, mental, healthcare needs. And do all of them need a hospital stay or an ER visit? Maybe, maybe not. But it's really hard to navigate that, and you don't want to guess when it comes to your loved one's care. So often we will just go. The other thing is too, is because sometimes we don't know, we might wait a little longer than we should, right? So there's, the scenario where we don't know, so we're going because we don't know. And then there's another scenario where maybe, you start living with the symptoms and you start getting used to it, and you don't really know that it's leading to something bigger, right? Because you're not an expert in dementia. You don't know all of the ways that the disease can express itself. And so you might wait a little bit longer than you should, and then later that leads to a more urgent hospital visit, a more urgent ER visit. It's a heavy burden on unpaid family caregivers. So again, we start with mom can't live on her own, and so maybe she needs we got an extra bedroom, we're gonna have mom come and live with us, right? And that's just so we can, she's not isolated, she'll have us around, but again, we have busy lives. Then what happens is maybe the disease progresses and mom really needs more support. All of that just kind of starts to be absorbed in the family. And as it gets absorbed, it's not like you're pausing and saying, wow, that was a lot more than I had thought it was going to be a year ago. Often your family is absorbing it, and then the burden on your family, and especially the primary caregiver. Often that's the child or a partner, a sister or brother, someone who is the primary person taking care of the person that has dementia or Alzheimer's. And there is a need for coordinated person-centered care. So what that means is, again, we have this fragmented, oh, did you bring mom?
We're sorry, 250 is closed, so it took forever to get here.
So the need for coordinated person-centered care is really is something that is needed, especially because our population is getting older.
Oh, it is.
And we did talk about our fragmented care system, right? So having a place, can you imagine if you can go to a place, or you had somebody that you can call and say, okay, I talked to my doctor and we went over to therapy and this, and then there was somebody that could help you navigate all of those things. It seems a little bit too good to be true, right? So what is the GUIDE program? So again, GUIDE stands for Guiding an Improved Dementia Experience. It's an innovative Medicare supported program. So Medicare has a number of innovative programs, and it's really designed to start streamlining and improving and being able to really start offering Medicare recipients a better experience. It's designed to help families care for loved ones living with various stages of dementia. And so I will say too, if there's dementia where it's diagnosed, and then there's also that feeling that maybe mom is experiencing a little bit of memory loss. Maybe dad is a little bit forgetful. That doesn't often have a very specific diagnosis, right? And so the GUIDE program, you don't have to have a diagnosis. There can be an assessment that will help you qualify for the program. And we'll talk about that in a minute. It provides expert guidance, caregiver support, and respite service at no additional cost for those who qualify. So, no additional cost. Let's just remember that right there. No additional cost, right? Mom knows. So what is included in GUIDE care? It's a comprehensive assessment of needs. So what happens is initially the recipient of the GUIDE program is assessed. So there's a different levels, if you will, of dementia and Alzheimer's. And so there could be severe memory loss, there could be moderate, and so there's an assessment done to see where the loved one is in that kind of spectrum. An individual care plan is determined because based on the assessment, not everybody is going to have the same care plan, of course, right? So one loved one, for example, that might have some moderate memory loss is not going to be the same care plan as somebody who has severe memory loss, right? Or might have some ambulatory challenges or some dexterity challenges. There's so many other ways that physically the loved one could be expressing their dementia, and all of that should be captured in the care plan. Dementia-trained nurse who reaches out for check-ins to monitor health. Now that's I missed number 3. Dedicated care coordinator or navigator. So there's someone that you can go to that can help you, like you might say, oh, well, I have a question about this, or what's the next step in that? There's a coordinator that can help you navigate. And that navigator also helps us as a home care agency navigate what the next steps are as well. A dementia-trained nurse who reaches out for check-ins to monitor health. Now that sounds very proactive now, doesn't it? But most of the services are virtual. So it's just the ability for a nurse who is assigned to your case to reach out periodically and say, how's Dad doing? Here's what we talked about before. Is that still happening? What can we do? And that, I think, is one of, that already feels better. Number 5, 24/7 virtual access to a care team to support for crisis or questions. So we talked about those increased hospital visits and ER visits, right? Imagine that it's the middle of the night, it's 11:30, right? And something's happened. Your loved one, maybe their eating has just changed a little. Maybe their toileting has changed. Something has happened, and your initial is like, I'm not used to that, hasn't happened before. You can call someone 24/7 and ask the question. And that right there will let you know, is it an ER visit or is it an appointment with your PCP, right? That is huge, right? Because our initial is we don't want it to be worse. We don't want mom to be sick. We don't want dad to have, and maybe there's some kind of experience from before. And so if that saves an ER visit, if it saves a hospital visit, that's a plus right there. The other thing is they might say, oh, this is important. We need to go to the hospital right now. And just having, we second guess ourselves all the time, right? We're making the best decision we can right now. And so to have someone you can call 24/7 and say, what do you think? Is this something that I should be on red alert about? Or is this something that can wait till tomorrow when I can call the doctor? And that's I think that's really big. Care coordination with existing doctors, specialists, medical equipment, and suppliers. Now that is something. So the idea is that your care coordinator would have all of your information. They would have information on your doctor. They would have information on what kind of medical equipment you have at home. They might have information on if you're doing PT or OT or all of these different support services so that they get the whole picture of your loved one. Because you're trying to do that already, right? Along with working and taking care of kids and right, and so you're like, oh yeah, mom has this on Thursday, and all of these different things. And so to have someone where you has the entire file and can look at it and help you navigate it, I think that's the kind of support and advice that we haven't had in the past. Medication review, I think this is another one. Often for seniors, they'll have a symptom, they'll get a medication. Have a symptom, have a medication, right? And so what ends up happening is there a total review of what medication is being prescribed right now? Sometimes it might be even over-the-counter stuff, right? Like vitamins and all of these other things. So to have someone where you can go and really review all of the things that dad is taking in his Monday through, like his 7-day, pill box, is really important. Maybe some of those things can be eliminated, or maybe we can question, why do we need this still, right? Family support, education, and training. This is really huge for caregivers. So again, you can go out and read a book or find some things online, but what the service providers are doing is they're developing portals where families can go in, they can take modules on dementia training. They can go for some very specific education, because not all dementia expresses itself in the same way, right? If you have a loved one with mild dementia, maybe that's one kind of training, and then the next one is moderate, and the next one is severe, because you don't need to stress yourself out with all of this information, but to be able to get it on demand where it's applicable to you, your situation, and your loved one, I think just becomes a better use of your time. And lastly, and one of the things that I think is a big plus for families is this last one. You might be able to qualify for 72 hours of paid home care respite hours for individuals with moderate to severe dementia. And what that means is it's 72 hours a year, but it is for the caregiver, because again, the thinking is you as caregivers are constantly worrying, caring, and loving your family member. Now, are you taking a break? Are you taking care of yourself? Have you been able to go to your own doctor's appointments? Have you been able to, have a date with your husband? Have you been able to take a weekend away? Have you been able to visit your kid in college? Without worrying about mom or dad. And so these 72 hours, although small, is 72 hours of free care. So who is eligible? So to be eligible for the GUIDE program, you have to have traditional Medicare Part A and B. You cannot have Medicare Advantage or Medigap. You cannot participate in a PACE program, so if you go to InnovAge PACE, you wouldn't be able to qualify, and you cannot be receiving hospice care. Although palliative care is, you can have palliative care and still qualify for the GUIDE program. Dementia diagnosis either confirmed by a clinician or an assessment can be provided. So like I said, sometimes a diagnosis has already been made. But if you are noticing that, many families, they're not trying to go to the doctor extra as well. What we could do is we could do an assessment. A nurse will do an assessment. It's a little lengthy, but it asks questions and it allows us to designate the severity of the dementia. It also provides a benchmark. So one of the things is the GUIDE program will provide benefits even though it's not severe or it's not moderate or severe dementia. And so today, maybe it's only mild and you don't qualify for those 72 hours, but a year from now, the disease has progressed and now it is, it's more progressed, so you do qualify for the 72 hours. Being able to do an assessment provides that benchmark, right? It's a full benchmark. It'll be able to ask all those questions. So the nice thing is you can see the difference, right? You probably feel the difference already, but to see the difference kind of in a quantitative way is really important. And especially it's how we qualify for the program. So what is the process? This is a little rudimentary, but the way the GUIDE program works is there's about 400 GUIDE approved providers nationwide, 400 nationwide, which is crazy because if you think about how many, 7 million seniors that might have dementia. So those 700 care providers, what they do is they provide all of those bulleted items of care. And then one of the care items is that 72 hours of respite home care. So what the providers will do is they will partner with different agencies to provide one or more of those items. So for us, for example, we partner with 3 different agencies, and they will do the nurse assessment, they will do all of those dementia care items, and then for that respite care hours, then the senior can choose for us to provide those home care hours. So just very briefly, so there's various ways to identify who might be a possible GUIDE recipient. So like this presentation, for example, you might know somebody who might be a GUIDE recipient. We do presentations, we go to facilities, we try to do outreach. People can just say, I heard about this program. Medicare sent out a big mailing just this past week to let people know about the GUIDE program. And so they might say, hey, I heard about this GUIDE program. How can I get enrolled? So there's various ways that somebody might be identified as a GUIDE recipient. then the guide partner will qualify that recipient. So to use an example, first thing that we did is we looked at our clients that are visiting angels, and we said, okay, who amongst our clients might be able to benefit from this program? And we did an outreach to them. And so once we identified, they would decide if they wanted to participate or not. Then what we would do is we would gather their information. And so it's just a small amount of information. It's their name, we have to get their consent because we are gathering the information and we're sharing it with the guide partner. We get the name, Medicare ID, contact information, date of birth. And what happens is our guide partner, again, the guide partner, there's 400 of them that are approved by Medicare. That's it, 400. So they have the access to Medicare to check the eligibility. Like, we don't do any of that, right? So that partner does that, they get all that information. The partner will also guide us. So for example, they'll say, okay, you sent us Miss Jones, and all of her information. Miss Jones's Medicare information or ID is missing a number. That happens. And we go back and we make sure that what was typed in was the correct one. The guide partner qualifies the recipient. They will have a welcome call, so that third little box there. So that welcome call is a conversation with Miss Jones. Hi, Miss Jones. I see that you're looking to enroll in the guide program. We have all of your information. They're validating that they do want to participate, that their consent is there. That's always very important. And then what they would say is, okay, we could see that you do qualify for the program. The next steps are. Or in one case, we forwarded a client, and unfortunately she did not qualify because she didn't know this, but she was already enrolled in Medicare Advantage. And if you're enrolled in Medicare Advantage, that will disqualify you. And so she didn't know that because, you know why? Her husband signed it up. You know, she's just like, I don't know. And so it was disappointing, but again, that check is done by the guide partner. And then assuming that we have enrolled the client, and that they qualify, then the guide partner will do the patient onboarding. Make sure that there's a file open, they actually create a physical file folder so that we can share information. And then the next part is where we partner with them. Now, the guide partner has many different partners. We are just one home care agency that they partner with, but they are not restricted to partnering with one. They could partner with 50. You know, because they often cover a large geographical area as well. So for example, Continuum is one of our partners. Continuum has hundreds of thousands of patients. And so they have partnered with many home care agencies. We also partner with a company called Pocket RN. Again, they're nationwide. They can partner with as many home care agencies as they would like. Because truthfully, the demand might be such that one agency can't really meet. If 50 guide patients decided to, or participants decided to sign up, well, that would mean that there's 50 requests for services all at once, and that would be a lot. So many partners partner with lots of different home care agencies. And then, depending on the guide partner, the home care agency or another service provider might do the nurse assessment or the safety assessment. So many of these guide partners are virtual. So they're not coming to your home. They have, you know, like Continuum, for example. Like somebody from Continuum is not coming to meet your loved one. But what they will do is there has to be a safety assessment. We are the home care agency that lives in the community. They'll say, okay, you visiting angels, go do the safety assessment. Or you visiting angels, we don't have a nurse available. You have a nurse available, you go do this, you do the assessment. So sometimes that's in collaboration with one another. And then once the nurse assessment and the safety assessment is done, then guide services begin. Now again, once approved, let's just assume that our loved one has severe dementia and they're approved for those 72 hours. You might not need to use those 72 hours right away. You might want to just hold on to them, right? You're managing well right now, you don't need to use them right away. The other scenario is you have needed a break like yesterday, and something is coming up and you really want to use those hours. But there's all of these other benefits that are offered to you, right? The education is offered to you, the 24/7 nurse is offered to you. All of that can get utilized, you know, outside of the hours of care. Because the hours of care, honestly, is just one bullet point, I think, amongst 9. And then again, like, so now you have, there's a graduation coming, and you need the weekend. And so you don't want to worry about dad at home by himself. So you call your home care service agency, you call us, and you say, I want to use some of my guide hours. And we just schedule those hours like we would schedule any one of our clients. So for us, we just put it in our normal system. We provide the same kind of care. Of course, the caregivers that we have they're certified, they're licensed. Again, one other thing is, for the loved one, they might not need personal care. Maybe it's just companionship. Really, dad can do everything independently. We just want to make sure he's safe for the weekend while we go on the graduation trip. Well, that's companion care. That's very different than if they might need some personal care, bathing, toileting, addressing those things. So what is free respite care? 72 hours of care per qualified individual per year. So that's 72 hours that you can use as you see fit. There are a couple of caveats. Care must be booked in 4-hour care sessions. So if you only need 2 hours, they're gonna charge you 4. And part of that is Medicare. That's how they're gonna bill, 4-hour increments. So you could use those 4 hours in any way they want. You could also stack them. Care sessions can be booked as needed individually, weekly, or consecutively. So for example, you have a doctor's appointment on Tuesday. You just need somebody here for those 4 hours. I would suggest that you get a cup of coffee and then you go to the doctor and then you use those 4 hours of care, right? Because you're gonna be charged with that 4 hours of care. It could be that you have an exercise class that you want to go to every Thursday night. So maybe it's a week, every 4 hours every week for until the 72 hours are used up. It could also be, like I said, a weekend where you need all the 72 hours at once. So you decide. The only caveat is that they have to be 4-hour increments. Care is designed around a care plan and an assessment. So because that care plan is done and the assessment is done, the care that is provided by the home care agency is going to be for the individual. So for example, if your loved one is independently living but has some memory loss, well, they don't need help toileting and dressing and bathing. Like, you wouldn't need that type of care. But on the other hand, if your loved one does need that support, so the care plan is going to be individualized, it's going to be based on the assessment that was done at the time that the person was entered into the guide program. Now, that having been said, as a home care agency, we are always going to pay attention to what that date is. Because as you know, senior care might progress quicker than some other things. So what might be your assessment today might not be appropriate a year from now, right? Or 6 months from now. So we, as an agency, always do an assessment every 3 months, right? And so we're gonna look at that. Guide-approved partners work with multiple guide-approved home care agencies to provide respite care hours. So like I said, we're not the only home care agency that works in Charlottesville doing the guide program. And so it's just important, if you already use a home care agency, ask them if they're an approved guide partner, right? Because it's just important, especially if you already have care. And then of course you can always call us. We're always happy to navigate with you. The assessment is done virtually. It's conducted virtually. So like I said, why it's really important for the loved one and the caregiver to be together. So a lot of times the communication has to come through the caregiver, make sure that like a Zoom call can be done, right? And a lot of the assessment is also about the caregiver, right? How much care are you already providing? How much, what is the communication? How do we communicate? How do we make sure that we have to do a nurse assessment? All of those different things that coordinate. One other thing is, when we talk about a caregiver, it's really easy if you're all in one house, right? That is the person who's your caregiver. We have some seniors where their caregiver might not live in the same physical location. They might be a son that lives in another state. It might be a friend that lives across the street. And so a caregiver is just a non-paid, a person who's non-paid caregiver, right? And we've seen all sorts of scenarios. And really, because seniors have lots of different care needs. And their scenarios are different, right? You know, somebody who might be across the street or who's been their neighbor for 40 years can check in on them, you know, whereas your son that lives, you know, in California, that might be a little bit more difficult. Agency partners provide secondary benefits, and so there's all kinds of, like I said, there's like 9 different bullet points. Home care, respite hours is just one thing, but those other benefits, including 24/7 nurse, those sorts of things. Respite can be combined with private pay, long-term care, and veteran benefits. And so we really like to point that out because for the VA will provide home care hours for veterans. That's one of the benefits that they can qualify for. And so a lot of veterans are worried that that might interfere, conflict, might, you know, negate some other benefits that they have. So you can Guide can be stacked with veteran benefits. I have a bunch of common questions that we hear, because we can guess what you might be wondering.
Yeah.
So I'm going to go through these, and then afterwards maybe see if there's any ones that we didn't capture. Okay. Is the Guide program really free? I ask that all the time. I'm like, okay, so what's the catch? The Guide program is fully covered by Medicare. There is no cost and no copays. How does the home care hours and billing work? Do I have to get reimbursed? So like if you have long-term care insurance, you pay and then you get reimbursed, right? And you have to, you know, submit care logs and all of these things. So it's not as easy, especially if you're busy, right? So here's the good news. Once you're approved for respite hours, the Guide partner and the home care agency take care of all the billing requirements directly. You don't see a bill. So what happens is, you know, we provided you care for that one weekend that you had to go on graduation, right? So we charge 72 hours of care. We charge that 72 hours of care to the partner, and the partner bills Medicare. So you shouldn't see any bill, because truthfully, like, we can do that all between the partner firms. When does the Guide year start? So it's July 1st to June 30th. So we just started our brand new year. So why that's important is 72 hours, but it's 72 hours a year. So, you know, again, in the scenario, you had your graduation in June, maybe in May, you use those 72 hours, but you want to go on vacation in August. Well, those are 2 different years, so you can go ahead and plan that. How long does the process take? So this is one that we are still learning as we go. It's a brand new program, and we have people that are getting into the program, they're becoming eligible, we're putting them in, and what we're seeing is eligibility can take about 7 to 10 days. And it's not because they can't do the check quick enough, but what happens is we talk to you, and then we ask you, when can we have that welcome call? And so you might say, no, not Tuesday, but next week. And so that's already like 7 days from when we had the conversation, right? And then you have that welcome call. And then from that welcome call, there's also, now we have to do the nurse assessment. Now we have to, so there's all of these other steps. So it's not that it can't happen quicker, it's just that the process just takes some time. And our availability and all of those different things. So for the eligibility is very quick. Once we get these small little data points, your name and birthday and your Medicare ID number, it is pretty quick because we enter it in a shared secure spreadsheet portal, if you will, and then our partner goes and checks it against Medicare, because they're the ones that have access to Medicare. We're so happy to not have access to Medicare, because we don't have to do any of those things, right? And then once we know that the person is eligible, then the onboarding process can begin. It usually takes 4 to 6 weeks, and I say that because there's got to be the assessment, there has to be the safety assessment as well, and then the Medicare approval, because we can find out eligibility as one step, right? But then once the assessment is done, then what's determined is the dementia severity, right? And so then the Medicare approval might be you're approved for everything but the respite hours, right? And then as we progress again, maybe there's another reassessment, and now you're approved for the respite hours, however that might be. So it does take a bit of time. We wish it happened quicker. At first they told us 4 weeks. We're like, From beginning to end, we're like, can I get more than 72 hours? So no, for individuals diagnosed with moderate to severe dementia, there's a maximum of 72 hours per year. But again, those hours are every year. So you can, 1 year 72, and then the only other thing is you use it or lose it. So if you have any hours at the end of the year, you want to use them. Do I need to repeat the process to qualify every year? No. Once you're approved, you're in the system. I think that the only caveat is if you had been diagnosed with like mild dementia, and then as the year has gone on, you might have seen a progress in the disease, you might need a reassessment because you might not have qualified for those 72 hours. And now you want that, you do qualify. And so that might be the only caveat, because you want that reassessment. I receive services from the VA. Does this disqualify me? So I already said no, you're able to receive both guide, home care benefits, as well as VA benefits. I live in a facility. Does that disqualify me? So no is the answer. Individuals that live in a facility may qualify for the program. The only big disqualifier is if you're in a long-term skilled nursing facility. But we have people that we are currently qualifying in independent living and also in memory care, because that is not long-term skilled. I don't have a local non-paid caregiver. We do need a non-paid caregiver, so it doesn't have to be local. And that's really because if you have a senior who is experiencing memory loss, and they are, self-identifying that they want to be in the guide program, there might be a point where they can't navigate their own care. And it is really for the caregiver. So there has to be somebody identified so that those educational resources can be accessed, so that the hours can be accessed maybe later, so that like the 24/7 nurse can be accessed, all of those different things. So you do need a non-paid caregiver. It does not have to be a local person. So it could be your son that lives in California, right? Which home care agencies are guide approved? Medicare has guide approved providers in each area. These providers are able to partner with one or more home care agencies to provide the respite hours. One of the things that we get, so we do these educational sessions often in the community, and somebody will say, oh, my aunt in Illinois could really use this. It is a nationwide program. And so we have the list of all of the different providers. We can certainly let you know who those are. Now, they have partnered with whichever home care agency in their area, whichever service providers. Some agencies or some providers may do all 8, 9 of the benefit items. They might do just 1 or 2. So it really just depends on the agency, how big they are, their capabilities. So for example, Continuum does most of them, but they will outsource the nurse assessment to us because they're not trying to send a nurse to every house, right? But we're here in the community. We have another partner in Lynchburg that's very small, and so they provide less of those services. So it just really depends. Is my current home care agency guide approved? We always say check with your home care agency. We know lots of them too, so we're happy to make inquiries and send information along as well. That's it. What questions do you have for me? What can I answer? Yes, one.
So most seniors are on Medicare Advantage or a supplement. Doesn't that
It's terrible, right?
Yeah.
So I will say this, so we had this discussion. We are very fortunate to always be in communication with our Java partners. We, in Charlottesville, many seniors are on Medigap, right? In other areas of the country, that is not the case. And it really depends, so even like Medicare Advantage, different states will provide better or less services depending on the state, right? And so many seniors, what we've seen is many seniors only have traditional A and B. And often the seniors that have only traditional A and B might be ones that don't access other services, right? So the luxury of being able to afford an additional Medigap or Medicare Advantage, they often are not able to take advantage of that. And so that, I don't know if that was the intention for Medicare. I mean, who knows? But it does disqualify you if you're Medigap or Medicare Advantage, unfortunately. Yeah. I would hope, so this is just the beginning of this program, and as we know, things evolve. And so what would be lovely is if those that create the rules could learn from the experience. Because even if you are able to afford Medigap, that doesn't mean you have a lot of money. That means you're just trying to, not lose everything if something catastrophic happens. And so we hope that, but right now that is a disqualifier, unfortunately.
Is there a website where we can find all this information and as it changes?
Yes, so the CMS website for Medicare has the information. I will share with you that it is as easy to understand as you could imagine it to be. Wasn't that so diplomatic? Like that? Right, so we have done presentations and with healthcare providers who have heard the GUIDE program coming, and they go to the CMS website, and it's a little hard to digest, because the idea that a partner is the one that's approved by Medicare, and then the partner further partners with others, it's like, who is actually providing the service? It gets very confusing. And so being able to do these types of things is so important. That's why we go out into the community, because whether, even if you, depending on when you need those respite hours, we just want you to go qualify. If you qualify for it, go get them, because it is 70, so they said 8 years, they've already had one of the years. For 7 more years, 72 hours could be made available to seniors. And I just feel like as many seniors can qualify for that, and we want that. So I'm sorry.
You mentioned independent living can not necessarily prevent you from qualifying.
That's right.
Is that still a true statement if it's a continuing care community? We have a few of those
Yes,
here.
so
Okay.
we do lots of presentations, because they're kind of sectioned off, if you will, right? So it's like one community is the independent part of the community, and another part of the community is the assisted living part, and the other part of the community might be memory care,
Yeah.
and then another part of the community might be skilled. So there could be up to 4, at one facility. It doesn't prohibit, but what it will do is they're going to interview you, right, in the welcome, and they'll say, what part of the community do you live in?
Okay.
And if you're in independent, like we do lots of outreach to the memory care unit, because you would think that for the folks that are residents in the memory care, we want their families to know about this program, because, why not, right? The other thing is, sometimes people will say, well, how can you use the 72 hours if you're already in a facility? There's so many ways. So home care providers are in facilities for various reasons. Sometimes it could be as simple as companionship, because what they're seeing is that their loved one is at a facility and they're starting to just be sad. And so having 4 hours where somebody can check in on your loved one it's huge. That's one way. The other way is sometimes folks are in a facility and they might have just had surgery, or they might just have had a procedure, and they need, a facility can't give you one-on-one care, right? There's usually one CNA, there's many patients, and so, but your loved one has had a procedure and you're really worried about them falling, or you're really worried about them, hurting themselves, they've just had a knee surgery, something like that. Then you could bring in a home care provider to provide that support in short-term respite. It's not ongoing, it's just until dad is back on his feet, maybe literally and figuratively, right? So. Any other questions?
You said it's per individual, so what if mom has just the beginnings of dementia and dad is severe? Would that be?
Those are 2 qualified people, right? And so that's really important too, because certainly dad in that scenario could qualify for the 72 hours, right? Whereas mom maybe not, right? And it might be that you work with the same home care agency, right? The home care agency knows that dad has 72 approved hours, right? And so by individual, because there is also a very individualized care plan, right? So one care plan can't be for them. Anything else? I really appreciate your time. If you have any questions now or in the future, call Visiting Angels. We're happy to answer. Just one more question.
What is the percentage of people just original Medicare. I
Oh.
didn't know that people just had original Medicare.
Yes, this is a
Just
great
not
question
A&B.
for Randy over at Java, who I have to say, when Rebecca and I were learning about the guide program, what did we do? We went to an educational session with Java, and Randy was like, why wouldn't you be on Medicare? So we had a whole robust discussion about like who created this. But yes, that is definitely one of the challenges. And I also would say, again, this is brand new. It seems a little silly, but all of these rules, Medicare rules, Medicaid rules, somebody is deciding them. And so I'll give you another small example. The reimbursement rate for seniors that are on Medicare when they go to home care for a home care agency is really small. So a lot of home care agencies don't provide home care hours because the math doesn't work. And so being able to, express your concerns to your Congress people, I mean, that is not for nothing. I mean, that's how it kind of trickles down, because they don't know it's a problem, and they're probably not worried about
No, because they
Medicare.
have their own
They're not on A and B and all of these. Meanwhile, our seniors, that is the majority, are on A and B and Medigap, and so that is really big.
So if we want those services, but we don't qualify, and I don't even care about the 72 hours, but I'd like the other 12 bullets.
Yes,
Is there somebody at Java that can tell, like, how can I get an assessment? You wait 13 months in Charlottesville if you go to UVA for an assessment.
Yes. So I'm sure that Java has probably some very specific sources. I'll tell you, just for home care. So one of the things that we do is, so whenever we start services for home care, we do an assessment. It's required by the state of Virginia, and it is the only way we can start home care. But what the good thing is about that is our nurse comes in, they do an assessment, they talk with your loved one, and then we get an idea. Are there pets in the home? How's mom doing walking? All of the different things. And that becomes, like I said again, a benchmark, right? We have had situations where the VA has approved 6 hours of home care based on their assessment. And then our nurse comes in and says, okay, here are all of the activities of daily living that our nurse has identified. Dad can't, dress without support. He can't go to the bathroom without, like all of these different things. And all of a sudden, we can use that assessment as a very concrete, proof that additional care is needed. And we've seen it where six hours seems to be the 6 hours a week, not 6 hours a day, 6 hours a week for, care. And then all of a sudden that turns into 20 hours. And that is a game changer for a veteran. Like 20 hours of care, that means that we can bring a caregiver to a veteran 4 hours a day for 5 days. And that is huge because on the weekends, usually family members can support on the weekends. It's just that we gotta work during the week, and that is when, and they're worried usually about getting dressed in the morning, and then in the afternoon being able to have a lunch, and then, kids come home, after school, those sorts of things. But to answer your question, I will, one of the things we haven't asked our care providers is if there's a kind of like like a program that you can sign up for, where it's not, covered by guide, but you love all of the different benefits, because that would be a great opportunity for them.
Is a diagnosis of dementia actually required, or?
It is not required. So what happens is the assessment is done, and the assessment has all of these different, questions, because a lot of seniors don't even go to the doctor, right? They don't go to the doctor much, right, for that diagnosis. So it doesn't have to be an official diagnosis. Our nurse will do an assessment, and then we can go from there. Now, then we hand off to our provider, or the provider will have the nurse assessment and say that. And now they have the nurses, right? The dementia trained nurses. And so they'll probably be the next steps after that, but no diagnosis.
I ask that primarily because there are patients that go into the ER, say, for example, or have a one night stay at the hospital and become completely confused and disoriented.
That's right. That's right.
And that's only a temporary situation a lot of times, but they're not actually.
I have to say, this is such a challenge for us. Rebecca and I talk about this all the time, because what we really want is we want to get to that patient, right? And there's not an avenue for it. We're just trying to do education. We're really trying to do outreach. But there's some immediate needs that happen in our hospitals. And not only that, but there's some immediate need with families that do have Medicare A and B. They have, that's maybe all they have, right? But how are they gonna get this information, right? They're not usually at job, they're not really sometimes calling Java. They're not, at the center getting educational information. So how do we get to there? So we really try to talk to the hospitals, try to get to the person, because there's got to be a place where we can reach the person who's having those conversations, because it's not immediate. I mean, we just talked about it's 4 to 6 weeks to qualify, right? But 4 to 6 weeks, I mean, dad might be in the hospital for a couple weeks. If we can get him qualified, maybe not immediately, but as he comes home, maybe there'll be some hours. And again, 72 hours is still better than 22 hours, right? And it gives you a little bit of runway. That's what we talk about all the time. 72 hours is 3 days for you to, get whatever you need organized at home, right, in place so that you can support your loved one. And so that is just really important. Thank you for your time. I really appreciate it. If you have any questions, please don't hesitate. Not just for the guide program, but we're really happy to be a resource. The number of times we are always talking to people about Java on the phone at our office is too numerous to mention. So thank you for your time.